Hi, and welcome back to our next session. It's gastrointestinal infections. The most important thing about GI infections has to do with food-borne diseases and food poisoning. When we have a person who has diarrhea, the first question is there blood in that diarrhea or is there no blood? Now, if the question does not describe blood, the first thing to look at in terms of diagnostic testing to determine the etiology of that diarrhea, if it does not describe blood, the first thing to look at is white blood cells. So first thing is blood. The second thing is white blood cells. Well, we have blood, we have white blood cells. Blood, we have white blood cells. Okay, so we have blood and we have white blood cells, okay? So the issue is, what we're gonna look for is the presence of blood and white blood cells. Now, if there is blood or white blood cells in the diarrhea, then the etiology has got to be something like salmonella and shigella and Yersinia we do go. And we have some Campylobacter is a very, very bad actor. Campylobacter. Salmonella, Shigella, Yersinia, E. coli 015787. So the question is going to be, if there is blood in that story, it means it cannot be something that is viral in nature. If there is blood in that story, if there is blood in the story, if there is blood or white cells in the story, it means it cannot be something like Staph aureus or Bacillus cereus. If it is Staph aureus and Bacillus cereus, if it is Staph and Bacillus cereus, there is no blood in the story. If there is Staph or Bacillus cereus, okay? Blood means no Staph, no Bacillus cereus, no viruses, no protozoans except Entamoeba histolytica. For instance, Giardia and Campylobacter, Giardia and Cryptosporidia. Giardia and Cryptosporidia do not give blood. The only protozoan that's generally going to give blood is going to be Entamoeba histolytica. Now, if there is blood, it means that these things are not possible. Blood means it has to be an invasive pathogen. Blood means it has to be an invasive pathogen. Blood means it has to be an invasive pathogen. Okay? So blood means it has to be an invasive pathogen. That means it's one of these things here. Okay? So therefore, Campylobacter, Salmonella, Shigella, Yersinia, E. coli 015787. Okay? So Campylobacter here with blood and Salmonella. Okay? So with these things, okay, with these things, these are simply the #1 most common in terms of frequency. Remember how we said pneumococcus? We said community-acquired pneumonia? Community-acquired pneumonia. Pneumococcus is simply the most common. Pneumococcus is simply the most common. Pneumococcus is simply the most common, and so therefore, that when you have this, you say, well, infectious diarrhea, Campylobacter, Salmonella is simply the most common. Is chicken and eggs still a cause of Salmonella? Yes, chicken and eggs are still a cause of Salmonella. We don't have any particular association for Yersinia and Shigella. Now, the question will often say a person has developed hemolytic uremic syndrome, but they don't exactly say they've developed hemolytic uremic syndrome. They say they have hemolysis, a high creatinine and low platelets. Hemolysis, a high creatinine and low platelets. Hemolysis, high creatinine and low platelets. Hemolysis, high creatinine and low platelets. They have hemolysis, a high creatinine and low platelets, and they have hemolytic uremic syndrome, but they don't use the phrase hemolytic. They say, what's most likely to be associated? What's most likely to be associated? Now, the most interesting questions, which is, do not give platelets and do not give antibiotics, have not been asked much yet. Even though the platelet count goes low, don't give platelets because they get consumed and used right away. Now, all it says is they've developed hemolytic uremic. What's the organism most likely to be associated with it? Next thing, what if they put in the story, they put in shellfish and seafood? They put in shellfish and seafood. Shellfish and seafood Okay, Vibrio parahemolyticus, Vibrio vulnificus, Vibrio parahemolyticus, and Vibrio vulnificus. Vibrio parahemolyticus and Vibrio vulnificus. Vibrio parahemolyticus and Vibrio vulnificus. Now, Vibrio parahemolyticus is simply on the parahemolyticus. Parahemolyticus is the shellfish. But vulnificus has a different association. Now, when we're studying for exams, what we're doing is saying, not that you know for sure what the organism is, but the question is not what is it for sure. The question is, which of the following is the most likely? Which of the following is the most likely? Which of the following is the most likely? So which of the following is the most likely? What's the most likely organism? So vulnificus is going to be seafood, but vulnificus is also going to give liver disease, and vulnificus is going to give liver disease, and vulnificus is going to give skin. Liver and skin. Okay, it's going to give liver and skin. So therefore, liver and skin. Okay, but Vibrio vulnificus, liver and skin. Okay, liver and skin findings. Seafood, Vibrio, parahemolyticus, vulnificus, with liver and skin. Okay, there's nothing particularly associated with Shigella and Yersinia. Okay, Vibrio cholera, we don't care that much about on step 2 because it's not a U.S. problem. Campylobacter is simply the #1 most common in terms of organism frequency. Now, the only way to tell for sure what the difference is between these organisms is with a stool culture. You can have questions that say, which of the following is the most likely, but you can't tell for sure. What's the most likely? Yes, but you can't say for sure. The only way to know for sure is a stool culture. What is the therapy? Young and healthy? No therapy. Young and healthy? No therapy. Young and healthy? No therapy. Young and healthy is no therapy. Okay? Young and healthy is no therapy. However, if it's severe, hypotension, tachycardia, blood, hypotension, tachycardia, blood, hypotension, tachycardia, and blood. Hypotension, tachycardia, and blood, and that is people who are going to need therapy. And when you do give therapy, the single therapy that is most likely to be effective is a quinolone. When you do give therapy, the therapy that is most likely to be effective is a quinolone. When you do give therapy, the therapy that is most likely to be effective is going to be a quinolone. Ciprofloxacin. Ciprofloxacin is the therapy that is most likely to be effective. Staph aureus and Bacillus cereus, okay, vomiting. 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 Staph aureus and Bacillus cereus, vomiting. Okay, because these are preformed toxins. They have no blood, but viral diarrhea gives no blood. Giardia gives no blood. Cryptosporidia gives no blood. Lots of things could give no blood. Matter of fact, you could have all these with no blood. Blood means that you have to have them. But the absence of blood, you can be anything. However, these as preformed toxins, they go in, they stay in your stomach, they irritate your stomach, they're in and then they're out. They're in and then they're out. Vomiting, vomiting. They're in and then they're out. Vomiting, vomiting, vomiting. Vomiting, vomiting, vomiting. The preformed toxin. They're in, then they're out. Okay. Staph and Bacillus cereus. Vomiting. Okay. No blood. Yeah, I know. Refried Chinese rice. Refried Chinese rice. But that's not as important as the issue of vomiting and no blood. Staph. Creamy sauce, man. Never eat potato salad that you have not made yourself, okay? Never eat cream salads at anybody's house, not even grandma's house, if you haven't made it yourself, because it's loaded with Staph aureus. If you can't get it to grow in a microlab, you can get it to grow in a salad bar. Staph, creamy salads, Bacillus cereus, Chinese food, but the most important thing is blood, no blood. People who have giardiasis is going to be associated with campers and hikers and campers. Cryptosporidiosis is going to be associated with HIV positive people. Cryptosporidia with HIV positive people. Cryptosporidiosis is going to be associated with HIV positive people. Giardiasis, Campers, hikers, fresh water, unfiltered. Also, giardiasis gives a certain amount of obstruction of the lacteals in the villi. So it looks like a fat malabsorption. It looks like a fat malabsorption. So it looks like a fat malabsorption, okay? So it looks like a fat malabsorption giardiasis, campers and hikers and hikers and campers and campers and hikers and hikers and campers. Giardiasis, fat malabsorption, flatus, abdominal pain. Flatus, abdominal pain, okay? So stool for giardiasis. Giardiasis used to be that stool, ova, and parasite exam. 3 ova and parasite exams, but 3 ova and parasite exams is not as good as 1 single stool Giardia ELISA antigen antibody. 1 single stool Giardia ELISA for antigen antibody is superior to 3 ova and parasite exams. 3 ova and parasite exams give you an 80 to 90% sensitivity. Giardiasis, 1 stool ELISA antigen is enough for ELISA antigen is enough for a person to make the diagnosis of giardiasis. Cryptosporidiosis, AIDS, low T cells. AIDS, low T cells. AIDS at low T cells, less than 50 to 100, at least less than 100 T cells. AIDS and low T cells. AIDS and low T cells, at least less than 50 to 100 T cells. Okay, now this is a special test, Cryptosporidiosis is not seen on an ova and parasite exam. Cryptosporidiosis is seen on a modified acid-fast stain. That is unique. It is seen on a modified acid-fast. Modified acid-fast is acid-fast. You mean like tuberculosis acid-fast? Yep. Cryptosporidiosis is seen on a modified acid-fast stain. Now, there have been 70 separate medications that have been tried to eradicate cryptosporidiosis. It is a very tough bug to kill. In normal people, it's a benign, self-limited cause of gastroenteritis. It comes and goes and disappears in a couple days. Gives you some poopy for a couple days and you feel well. In HIV with low T cells, it can be a near life-threatening wasting syndrome. In HIV-negative people, it gets better on its own. In HIV-positive people, you have to fix the HIV. Antiretrovirals raise the T cells. And when the antiretrovirals raise the T cells, the cryptosporidiosis goes away by itself. When you raise the T cells, the cryptosporidiosis goes away by itself. The treatment used to be giardiasis. For giardiasis was metronidazole, and it is metronidazole. It was metronidazole, and it is metronidazole. There's a new drug that could be used for giardiasis called tinidazole. However, metronidazole and tinidazole, same thing. Metronidazole, tinidazole for giardiasis, same as it ever was. What's new for giardiasis? Stool ELISA antigen antibody. 1 single test gives a 90% sensitivity. Cryptosporidiosis, AIDS, low T cells, modified acid-fast stain. AIDS and low T cells, modified acid-fast stain. Modified acid-fast stain. Okay? Giardiasis, cryptosporidiosis. Okay? Viral diarrhea. Viral diarrhea has no specific diagnostic test and does not require therapy. Now, the only one of these that's a little bit different is we're going to say one word about Clostridium difficile. Clostridium difficile is going to be associated with antibiotics. It's associated with antibiotics. The diagnostic test is a toxin. And why the diagnostic test is a toxin? Why the diagnostic test is a toxin? Why the diagnostic test is a toxin? Is that it's very difficult to culture. Why the diagnostic test is a toxin is because it's very difficult to culture. Why the diagnostic test is a toxin is it's very difficult to culture. The treatment is metronidazole. I don't actually think this is going to be asked too much, except if they want to give you one easy question. The biggest issue is going to be this. The person has C. difficile associated diarrhea. They get better in response to metronidazole. and the patient's infection recurs 1 or 2 or 3 or 4 weeks later. They get better, and then they recur and get worse again. What's the therapy? Metronidazole again or vancomycin? Remember, you give metronidazole and it gets better. You get metronidazole and it gets better. You get metronidazole and it gets better. And when you give metronidazole and it gets better, if it recurs, you retreat with metronidazole. If it recurs, it retreats with metronidazole. Okay? If it recurs, you retreat. So therefore, if you want to have the person get better again, you do not switch to vancomycin. If the person does not get better and fails to respond, that's when they go to the vancomycin. Vancomycin is people who are not better. If you get better, then you retreat. If you get better, you retreat. So if they recur, you retreat. If they don't get better, you switch to vancomycin. The first thing in terms of infectious diarrheas is there blood or no blood. Blood means it can't be staph, bacillus cereus, these things over here. Blood excludes these. No blood could be any of them. If there's blood, get yourself a stool culture to see which organism it is. Most likely, Campylobacter. E. coli 0157, hemolytic uremic syndrome. Let's look at a couple of our slides here, and we see, rotavirus, most common in young children. That's true. It's spread in nursery schools and just amongst young children. As a matter of fact, you can make a play for rotavirus being the single most common cause of death in the world, depending on whether you cause it as death in adults or death in children. Campylobacter is also associated with Guillain-Barré, and that is for unclear reasons that you get Guillain-Barré in association with Campylobacter. Not clear. AIDS diarrhea is people who have cryptosporidiosis. Remember, cryptosporidiosis is a modified acid fast stain. A modified acid fast stain. Now, although E. coli 0157 gives undercooked hamburgers, it was also in a spinach outbreak. And this year's question may be the spinach outbreak question or the hamburger one. But the biggest issue is here, is whether or not the person has blood or no blood. If you have blood, it means that it has to be an invasive pathogen. If there is serious life-threatening infection, fever, hypotension, bloody diarrhea, abdominal pain, fever, hypotension, bloody diarrhea, and abdominal pain, then the treatment is a 5-fluoroquinolone. That's an end to our infectious diarrhea. Now, some of these infectious diarrheas may seem to you like, yeah, whatever, we're looking at the infections of shellfish and seafood and oysters and clams and mussels, rich people diseases, but you know what? Fundamentally, you're far more likely to get a shellfish question than you are to get a Vibrio cholera question. And that's the end of GI infections. See you in the next section.